Having said all this, I'd love to take a few questions and or comments from you. Yes, ma'am.
I get it.
I think you should.
But you don't get choices. Like, I didn't want to go on Medicare. I don't get any choices.
They don't?
No. And
Well,
that's what I
they
understand.
do, but here's how the choice works as I understand it. If you don't want to be on Medicare and you qualify, you have to forsake not only Medicare, but Social Security. And I know that from the experience of my own patients who have come to me and said, Dr. Coday, I tried to get out of Medicare because I'm well off financially and don't even need it. And I was told if I did, I'd be booted out of Social Security as well. So I thought I better not do it. You're absolutely right. And furthermore, let's say you're in Medicare and you go to a doctor and you have an office visit and you might say to the doctor, you know, doctor, I'm well off financially and I know Medicare's in trouble. Let me pay for more of this than Medicare would require. A lot of seniors would be willing to do that. They won't let you. They won't let me. They force us to do the usual and customary thing. There's no alternative. You're absolutely right. And many seniors are well off financially and could pay more. Many seniors are very poor and can't. I understand that. But we need an intelligent Medicare system that's a little more flexible, that can allow people who want to pay a little bit more to do so.
A number of us are on TRICARE because retired military, whatever.
Yeah.
We use TRICARE, we don't lose it, we don't pay for it anymore, we're on Medicare. We don't have the option.
Yes.
Is
Yes.
that true?
Yeah, you have very limited choices in Medicare. Now, Medicare is not all bad. Medicare is a great program. It's done some great things. You know, through it, our seniors can get the best care in the world, and that aspect of it's very good, and we need to preserve that. But I think we need to come up with some creative ways to provide the flexibility that you've referred to give you the option to pay a little bit more if you want to do so. I think a lot of seniors actually would. I've talked to many of them. Other comments or questions?
Well, we hear about all the waste, fraud, and abuse in Medicare and Medicaid program. And I read someplace that IBM designed a program that would, take care of preventing all this waste, fraud, and abuse, but nobody wants to have anything to do with it. Probably if the waste, fraud, and abuse was eliminated, Medicare would be in good shape.
You've hit on a really important topic, and for both Medicare and Medicaid, this is a big issue. I'm not an expert in this area, but I suspect it's even more of a problem in the Medicaid program for the poor. And I say that based on my own experience as a physician, taking care of both Medicare and Medicaid patients, because my patient practice consists probably well over 90% Medicare and Medicaid, a few cash payers and a rare privately insured patient. The Medicaid program for the poor, I think, is more susceptible to fraud and abuse. For example, it's easier to convince the government you're poor than to convince the government you're 65 if you're not. Because they know how old you are. It's much harder to concoct that than it is that you're poor. Much easier to demonstrate that you're poor. And I think there's a lot of that goes on. People convincing the government they're more poor than they actually are. And as a doctor, I see it. And as the doctor, I have to just remember I'm only there to be the advocate of the individual patient. I'm not there to be the police force of Medicaid.